Okay, thank you all for joining me. I'm Karen Enriquez, the Seago Area Agency on Aging Family Caregiver Support Program Care Coordinator for Cochise, Graham, Greenlee, and Santa Cruz counties. Just so you know, all participants have been muted, but you are able to type in questions and comments, and I'll address them as time allows at the end of the presentation. If you prefer, you can also call me or send an email after the webinar ends. Let's define now. The World Health Organization has officially declared COVID-19 a pandemic. The virus has affected people globally, impacted financial markets and local economies. It has also resulted in deaths, and the numbers are expected to climb. Governor Ducey and Superintendent Hoffman have announced the extension of school closures through the end of the 1920 school year. Our nation's response to this situation has revealed many strengths, but just as many weaknesses. But it will always have the public's best interest at heart. When survival anxiety is high and toilet paper is nowhere to be found, it's very easy to become nervous and anxious. Anxiety has a way of making people either under or overreact. The greater the anxiety, the more you will see people shaming and blaming. It's all about those hoarders. But how many of us have faced the hoarder dilemma? When you're in the store and the aisles are completely empty and toilet paper is nowhere to be found. But not just toilet paper, it's the napkins and the baby wipes, even the paper towels. It seemed like almost overnight, all of it was gone. And then one day you walk into the store and there it is. Charmin, will you stockpile? It sure has crossed my mind. A toilet paper panic sounds absolutely silly, but here we are. Let's try to balance our anxiety and response to the fears of others with understanding and respect. We have to realize that uncertainty and second guessing is natural. Stores are now enforcing limits, and by doing so, they're also enforcing sharing. We do need to be prepared and balance what we should and shouldn't do, and we need to be vigilant. Everyone has heard the universal precautions. There has been a constant stream of information regarding the virus, and we're all doing the best to follow the guidelines. Don't touch your face. Families caring for a vulnerable adult child should use extra caution, and they should monitor themselves and practice vigilant hygiene. Disinfecting frequently touched areas, in addition to regular hand washing, has to be a priority. Immediately dispose of tissues, swabs, gloves, or saturated items. Disinfect that medical equipment, such as wheelchairs, walkers, oxygen systems, or any other day-to-day items often. Remember to wash your hands thoroughly after each cleaning, and communicate with your pharmacist and your primary care doctor. Ask about having prescriptions filled early and consider having them delivered by mail or drive-up pharmacy. If you're concerned, call. Don't go into your medical provider. Everyone should be aware of the steps to take if they or their loved one becomes sick. Go for the facts. Without information, anxiety escalates and your imagination can really spin out of control. It's important to get the most accurate information. The Center for Disease Control, CDC, is monitoring the situation closely and is the best source for information about COVID-19. Once you have the facts, remember to take breaks from watching, reading, or listening to the news. And be mindful of misinformation and avoid getting caught up in social media. Set boundaries and walk away from it occasionally. Protect yourself from scams related to the virus. There are so many out there. There are reports of shopping thieves offering to shop for self-isolating seniors and only to take their money. Door-to-door services claiming they can sanitize your home. Miracle products and COVID-19 vaccines are on the internet. There are no current vaccines for COVID-19. There are reports of Arizonans receiving text messages about being pre-qualified to receive money as a result of the virus outbreak. Financial assistance in the form of government checks are not yet a reality. Anyone who tells you they can get you COVID-19 money is probably a scammer. Phone scams, robocalls, text messages, scammers are out there. Please feel free to reach out to the Area Agency on Aging before giving anyone your personal or financial information. But please do respond to the census. Due to the coronavirus, some of the door-to-door field efforts by the census were suspended. Individuals with P.O. Box addresses may have not been contacted, as well as those in rural areas. The 2020 census will be the first time that the public can respond online or by phone, in addition to the traditional paper response. The information to do that is shown on the slide. And when you're reaching out to your friends and families, please remind them to complete their 2020 census questionnaire. The COVID-19 will eventually be a controlled virus, but the census will impact Arizona's share of federal funding for the next 10 years. Most of us do our best to believe the glass is half full. This is called practicing serendipity, the act of transforming adversity into inspiration. Serendipity is also a characteristic of resiliency, and resiliency is defined as the toughness required to overcome difficulty. It is the ability to focus on the value of being, to look for the humor, and to accommodate change. Be resilient and look for those rainbows. Now is the time to turn toward each other. Don't be afraid to ask for help. While we can't ignore our fears, if we make a deliberate effort to hold on to our humanity, it can bring us together. We need to protect vulnerable older adults. They're scared. Ask yourself what you can do to help. It's amazing how good you can feel about doing something as simple as picking up a carton of milk for someone. Although leaving the house makes you feel like you're making a supply run on an episode of The Walking Dead, when you do venture out in public, be respectful and be courteous and try not to complain. Say thank you to those who are risking their health to serve you. Everyone is anxious about being and staying safe. And not everyone will behave badly, but be mindful of tolerance levels. They're at an all-time low. Be positive and show kindness whenever possible. So, to put this in perspective, I agree everything right now is unpredictable and uncertain. Don't let fear and anxiety become a pandemic also. There's time to change the course of COVID-19, even if it's hard to remember when we're hand washing, stockpiling, and practicing social distancing. Take a deep breath and remember Remind yourself that most people who get COVID-19 will only have mild symptoms, and the vast majority of people who have had it have recovered. Children are not particularly vulnerable to it. We know where the illness came from, and the situation in that country is improving. Keep in mind you can kill the virus with a spray and by hand washing. But most importantly, remember, science is all over it, and a vaccine is currently in the works. Self-compassion. It's simply giving the same kindness to ourselves that we would give to others. We need to be gentle with ourselves. Lowered immunity as a result of stress can lead to an increased risk of illness. Cut yourself some slack on the days you're not feeling well. Anxiety is inevitable, and it's normal to feel a bit overwhelmed. But by managing our own anxiety, we can stop it from spreading to others. If intense anxiety is causing worry and sleeplessness, if you feel out of control, or if you're suffering from constant panic attacks, you can call your primary care doctor to put you in touch with a mental health care professional. But don't skip that self-care. Slow down and try to keep regular routines. Shower and get dressed every day. Be beautiful. Take off those stretchy pants and put on your jeans occasionally. It'll remind you to practice social distancing from your refrigerator. Stress eating is real. Practice other good healthy habits. Get plenty of sleep, be physically active, drink plenty of fluids, and eat good food. And most importantly, breathe. Try something new. The directive to reduce contact with the outside world is a perfect opportunity to slow down. Pay attention to how you and your family members are feeling and acting. Allow everyone a little extra space if they need it. Focus on the many things that you can control and try something new. Add something joyful to your daily routine. The Seco Area Agency on Aging endorses Tai Chi, which is often described as meditation in motion, but it could also be called medication in motion. There is growing evidence that it has value in treating or preventing many health problems. And you can even get started if you aren't in the greatest of shape. Look online for a dance class and get the entire family moving. Enjoy the sunlight. Get that vitamin D whenever you can. Walk together as a family. Have breakfast outdoors occasionally, or plan a picnic. Find a new recipe and cook together. My favorite is to bake some bread. Kneading that dough is really therapeutic, and the smell when it's baking, oh my goodness. Try gardening. It's a great way to get the entire family involved. Just a little effort and a little water, and you will soon be watching things grow. Take time to teach your children the value of creating, or cooking, or whatever lifts your heart. Find a craft that you are passionate about and never tried, and try it. Explore Pinterest online for ideas. It's my go-to. Google creative ways to enjoy social isolation or free stuff to do at home. I Googled 20 ways besides Netflix to keep busy during the pandemic, and I found symphonies that are broadcasting live performances and many zoos that have virtual activities for kids. Even spring cleaning, which isn't nearly as fun, can give you that sense of purpose and accomplishment. And on a personal note, my Scrabble friends, online Scrabble friends, have never been so responsive. So my question is, How do you change an ordeal into an adventure? The answer is change your attitude. Reach out and connect. Social distancing is considered critical to slowing the spread of the coronavirus, but it can also lead to loneliness. Find ways to remain socially connected while you're physically disconnecting. You can maintain those connections without a risk of getting the virus. Stay in communication with your family and friends. Reaching out brings that feeling of comfort and stability that you need right now. Technology allows us to FaceTime our families or to Skype, or you can even have an old-fashioned phone conversation. We have time. We have time to call those old and close friends to make sure they're okay. You might make their day. Things will seem a little bit more normal when you can share your feelings, and it can relieve stress. It's really good to laugh about what's happening, so share the humor. This isn't our forever. Life has changed temporarily, and everyone is in this together. But it's important to remember this is not our forever. Our normal way of life will return. So, in the meantime, do what you can to protect yourself and your family. Focus on that excellent hygiene and keep up the social distancing practices. Focus on what you are grateful for and what you value. Show your appreciation. Learn ways to calm yourself and to find that peace of mind. And remember, action is powerful even if you just start with one thing at a time. When things seem like they're falling apart, let's work to put them back together. And please, share some of that extra toilet paper. Thank you all for listening. I have a few minutes to address questions or comments, and let's see what we have. Remember, the Seco Area Agency on Aging is always here for you, and our contact information is on the screen. We have a very current, up-to-date Facebook page, and it is full of information from the CDC, from valued websites. Our website is also a good source of information. And as usual, I talked very fast, and this webinar will be ending fairly soon. I don't see any questions. I will send out a brief poll so that I can get some response on this. And if there are no questions, you are always welcome to reach out to me and directly. My email address and my phone number are there. And I hope all of you remain safe and healthy and just practice that social distancing and wash your hands. Thank you so much. Bye.